Okay, today we're going to summarize the results of this paper for ASH 2025 on the exact system for precision clinical trial matching. We're going to evaluate the accuracy with follicular lymphoma trials. So exact stands for extracting attributes from clinical trials. It is the underlying software behind CancerBot, the precision clinical trial matching system. So the challenge of clinical trial matching is how do you get a patient with all of their individual statistics and matching trials which have quite extensive criteria, especially in hematology, for are they actually eligible for the trial. So current trial matchers, both commercial and open source, try to rank trials based on suitability. They're not actually trying to do true eligibility assessment. So they say, okay, we have this patient vignette, not even usually a full patient record. And now we need to say, okay, out of this small test set of trials, not even all the trials in the world, okay, the clinician goes and says, okay, this is the best one. And then if it's within the top N, typically top 5 of the trial matchers rankings, then it's assessed to be good. We're assessing it in quite a different way because what we're trying to do is convert things to structured criteria. We use 84 criteria that are commonly used in follicular lymphoma trials. Then we say, given a very detailed patient record, do they actually match the trial criteria? And the way that we do that is we say, to assess that accuracy is, okay, are we actually extracting the 84 attributes successfully? So our aim is to assess more specifically the precision, recall, and F1 of the patient eligibility attributes. And then we're going to also summarize that precision, recall, and F1 for labs, blood, and behavior. Now, precision, of course, is when we extract an attribute, is that in fact correct? Recall is, okay, out of the unstructured text, what percentage of those attributes are we successfully extracting? So the way that we're doing this to give us an 80 confidence that we're doing it accurately is we're not going to actually label all 1,291 trials. We're going to have subject matter experts label a subset, 100 trials at random. This gives us an 81.5% confidence of 5% error. So then we have the biomedical subject matter experts label each of the 84 attributes for those 100 trials. And the results overall are quite good. But let's go ahead and summarize what actually happens here. We have an unstructured trial here on the left. It's quite extensive, difficult to follow. We then process it through our system. We read from all these trials databases. We load them into a data lake. The subject matter expert prompt engineers fine-tune each of these 84 prompts. They're stored in a prompt database, and an extraction engine then takes the unstructured data from the data lake and then asks 84 questions for each one of the trials, each one of the 1,291 trials, and then we populate this master database of all the world follicular lymphoma trials with structured eligibility attributes. And then the result is what you can see on the right, where we have all of these patients. We have all of the attributes such as ECOG, no HIV, no Hep B, Hep C, HIV, no active malignancies, and all of the other criteria that are used to determine the trial. And then next to that is the patient attributes, and this patient is in fact fully eligible for the trial. So the results overall are quite good. The F1 is 0.81. That if you look at it by category, most of the values are above 90%. The treatment is an F1 of criteria about treatment, like exclusions of therapies or requirements for certain therapies, components, or types is 0.68. So the accurate extraction of attribute criteria allows patients to take a patient record and then say definitively, are they a match for the trial? We are extending this to additional cancer types. We've actually added multiple myeloma within the hematological cancers and have added breast cancer, and we're adding more as time goes on. And we are giving this away free to foundations that want to have their own trial matcher. Can they just use our software for free to provide that to their patients? So we hope you take the time to give it a try on cancerbot.org. Thanks very much for your time.